Tom Cotton, a Republican senator from Arkansas, spoke about healthcare reform, and he said some things that are positively ludicrous.
By removing the Medicaid expansion that happened during Obamacare that helped provide health insurance to 250,000 Arkansans, this replacement is going to take it away. Does that concern you?
Well, Jake, First, I agree that the legislation could provide more flexibility, more discretion to governors and legislatures. It also ought to include tougher provisions on accountability. But second, there is an interaction between the Medicaid parts of this bill and the private market parts of this bill. Medicaid is a welfare program. It's primarily designed for the indigent elderly, the disabled, the blind, and children. It's not designed for able-bodied adults. We want to get those people off of Medicaid into a job and into market-based insurance. That's one reason why I worry that the private market provisions of this bill aren't adequate to bring down premiums. Because ultimately, in Arkansas, for instance, tens of thousands of people leave Medicaid every year. I want to make sure that the market insurance system is working for them so they can afford health insurance and get off of Medicaid.
That was rich. He said Medicaid is welfare, and it's not for able-bodied adults. We want to, get those people a job and get them off Medicaid. Hey, Tom, there are many, many, many millions upon millions of able-bodied adults who are poor and can't afford health care. That's why Medicaid exists, so that we get those people health care. He's like, no, if you're an able-bodied adult, you shouldn't have it. You shouldn't have Medicaid if you're an able-bodied adult. Are you unaware that there are tens of millions of working poor people? So he says, we got to get them a job. What about the people who have a job, but they still don't make enough money to afford health care, and they need Medicaid? What about them? It's a welfare program, and if you're an able-bodied adult, you shouldn't get it. Then what are you proposing? They can't afford it in the private marketplace, so they need Medicaid. So what are you proposing? They just shouldn't have health care? Look, you're saying it's a welfare program, which you disgusting welfare. Ugh. Get away from me. So you hate welfare, and then you're saying able-bodied adults shouldn't be on Medicaid. So that would mean if you're poor and you're sick, you don't get help. You don't get health care at all. Guys like Tom Cotton view poverty as a moral failing, as opposed to an inevitable consequence of a capitalist system. Dude, 50% of the country makes $30,000 a year or less. To Tom Cotton, he goes, oh, they're all just morally inferior people. They're all just lazy. Hey, Tom, here's a question. When the subprime mortgage crisis and the Great Recession hit in 2008, and you had unemployment skyrocket virtually overnight, what was happening there? In Tom Cotton's fucking kooky-ass worldview, if he's being consistent, he would go, wow, looks like millions of people decided to become lazy overnight. Or they got fired, and they got fired because of market consequences that basically had nothing to do with them. So they're hardworking people who mean well, they take care of their families, they do their best, and overnight, you lost your livelihood. In Tom Cotton's mind, lazy, they're just lazy. That's what it is, they're lazy. Dude, there are people who still work 2 jobs and live under the poverty line. What do you want to do, Tom Cotton? You just want to... Able-bodied adults shouldn't be on Medicaid. So they can't afford private health insurance, and they need coverage. What do you want them to do? What do you want them to do? His answer is fucking bleed out in the street. His answer is, I don't care. Because again, he views poverty as a moral failing. So it's impossible that, you're a human being in a complex situation and you work full time but don't make enough money to survive. Do you not know what working poor is, Tom Cotton? That people do work full time and not make enough money to survive? But again, he blames you. And then when people try to come around and propose legislation that says, hey, maybe if you work full time, you should make enough money to survive, he goes, no. So you're just anti-poor. You just want a permanent underclass that can work full time, not make enough money to survive. And then you say, when they need health care, I don't care. You're not going to get it. You're not going to get it. He views the world like a child. It's like he grew up listening to fucking Rush Limbaugh, and he thought like he was a god or something. And whatever nonsense, backwards ass talking points he spewed about the poor being lazy parasites and moochers, he took it to heart. And now he says shit like Medicaid is welfare and able-bodied adults shouldn't get it. Well, then you're going to have millions and millions and millions and millions of people who are poor, able-bodied, and they work, and they still don't get it. They still can't get health care. Is that the country you want to live in? Other modern nations, everybody gets health care. Single-payer system. You just get it. It's part of being born. Just like, you're born into the U.S. Today, and what do we have? Well, you have cops that protect you. I mean, you have cops. It is what it is. You have a fire department. It is what it is. In other countries, you add healthcare to the list. Yeah, we just have healthcare, of course. Sick, help. You get sick, you get help. That's the way it works. Tom Cotton thinks that's gross and crazy and backwards, and he thinks if you're poor, you shouldn't get healthcare. That's what Medicaid is. Medicaid gives healthcare to the poor people. And by the way, the line, Obama expanded it and raised the line for the amount of money you make where you can get Medicaid. But he says, no, not only was it too high under Obama, it's too high, period. If you're an able-bodied adult, you shouldn't get Medicaid. So if you're poor, no health care for you. And that's what Tom Cotton likes. That's his ideal. And he's the senator for one of the poorest states in the country, Arkansas. He's against you, guys. People in Arkansas, he's against you. He looks down at you. These guys pretend like they're anti-elite, anti-elitist. He is the elitist. He's the quintessential elitist. He wants to craft a healthcare reform that's good for the health insurance companies and nobody else. That's why I keep saying market-based. We got to put it in the market. We just covered the story the other week. Only 80% of the money that goes into private health insurance companies, only 80 cents on every dollar goes to actual care. In Medicare, it's 94 cents of every dollar that goes to care. So it's less efficient, it's more expensive, has worse outcomes, you cover fewer people. It's all downsides, but that's the thing is he doesn't care about the actual effect of it. All he knows is, hey, they're my donors, so I'm going to do their bidding. So this is gross, and Tom Cotton is a scumbag, and he doesn't think poor people should have health care. And that's not an exaggeration because he said it. Able-bodied adults shouldn't be on Medicaid. Able-bodied adults. Well, there are many able-bodied adults who work who can't afford health care and they're on Medicaid. You want to kick them off. Thank you. Thank you very much, Tom Cotton, for being honest about what you believe.